Imagine this. You're on the operating table, heart pounding, about to experience surgery. The lights are blazing overhead, the air is crisp and sterile, machines are humming all around you. As you drift into sleep, your mind races. Who's the surgeon about to work their magic? When you think of surgery, who pops into your head first? Of course, the surgeon. The one wielding the scalpel, the star of the show. They get all the glory, all the applause, and hey, they absolutely deserve it. But wait, there's another hero in the room. Someone whose job is just as life-saving, just as intense, but who's almost invisible to you, the patient. Today, we're pulling back the curtain and blasting the spotlight on the true unsung heroes of the OR, anesthesiologists and certified registered nurse anesthetists. This anesthesia team doesn't just put you to sleep, they literally hold your life in their hands when you're at your most vulnerable. They're the guardians you never see, the protectors you never meet, but their expertise is the razor-thin line between a smooth surgery and a full-blown emergency. So buckle up. Let's jump into the fascinating, high-stakes, absolutely vital world of anesthesiology. Let's start by destroying some myths. When most people think about anesthesia, they have this oversimplified image. Someone comes in, puts a mask over your face, you count backward from 10, and then you wake up hours later feeling groggy. The anesthesia team, they've disappeared somewhere, probably having coffee while the surgeon does all the real work. This couldn't be further from the truth. In reality, the CRNA and anesthesiologist are there for every single second of your surgery. From the moment you go under until the moment you're stable in recovery, they never leave your side. Their job isn't just to knock you out. It's to become your body's temporary guardian, your physiological substitute, keeping you alive while you literally cannot do it yourself. Think about this for a moment. When you're under general anesthesia, you're essentially in a controlled, reversible coma. Your brain isn't telling your body to breathe. Your reflexes aren't working. Your blood pressure regulation is compromised. You can't swallow, you can't cough, you can't protect your airway if something goes wrong. So who's doing all of that for you? The anesthesia team. They're like pilots, and I mean that literally. They don't just get the plane off the ground and hope for the best. They monitor every instrument, every gauge, every tiny fluctuation in weather and air pressure. They make constant micro-adjustments to keep you flying safely until it's time to land. Now, here's where it gets really interesting. Anesthesia isn't some one-size-fits-all approach where everyone gets the same treatment. Your anesthesia team is essentially creating a custom pharmaceutical cocktail designed specifically for you. They take into account your age, because a 25-year-old processes drugs very differently than a 75-year-old. They consider your weight, your medical history, any allergies you might have, medications you're currently taking, and even the specific type of surgery you're having. A brain surgery requires different considerations than a knee replacement. Then they have to choose the right type of anesthesia. General anesthesia makes you completely unconscious. Your brain is essentially turned off in a controlled way. Regional anesthesia numbs an entire region of your body, like an epidural during childbirth that blocks pain from the waist down. Monitored sedation keeps you sleepy and comfortable but still breathing on your own. But here's the really mind-blowing part. They have to calculate drug doses with incredible precision. Too little anesthesia, and you might experience something called anesthetic awareness, waking up during surgery, which is exactly as terrifying as it sounds. Too much anesthesia, and you risk dangerous drops in blood pressure, breathing problems, or even cardiac arrest. We're talking about margins of error measured in milligrams. It's like being a chemist, a pharmacologist, and an emergency physician all rolled into one. And they have to get it right every single time, because there are no second chances when someone's life is on the line. Once you're under anesthesia, the real work begins. And by real work, I mean some of the most intensive medical monitoring you can imagine. Your anesthesiologist is watching more vital signs than a NASA mission control operator. They're monitoring your heart rate and rhythm, not just making sure your heart is beating, but that it's beating correctly. They're watching your blood pressure minute by minute, because anesthesia affects how your blood vessels behave. They're measuring your oxygen saturation to ensure every cell in your body is getting the oxygen it needs. But it doesn't stop there. They're monitoring your carbon dioxide levels to make sure you're breathing properly, or if you're on a ventilator, that the machine is doing its job correctly. They're checking your body temperature, because anesthesia can interfere with your body's ability to regulate heat. Some procedures require monitoring brain activity to ensure you're getting exactly the right depth of anesthesia. And here's what makes this truly remarkable. They're not just passively watching these numbers. They're constantly making adjustments, second by second, based on what they see. If your blood pressure drops, they might give you fluids through your IV, or administer medications to support your cardiovascular system. If your heart rhythm changes, they respond immediately with appropriate interventions. They control your breathing, either by managing a breathing tube that goes down your throat, or through a specialized mask that ensures you're getting the right mixture of oxygen and anesthetic gases. They're literally breathing for you when you can't do it yourself. In essence, they become your body's substitute autopilot system. Your brain isn't monitoring your vital functions anymore, they are. Your reflexes aren't protecting you, they are. It's like having a medical expert whose sole job is to be your body's backup system for every critical function that keeps you alive. Now let's talk about what happens when things go wrong, because in medicine they sometimes do. And when they do, anesthesiologists are your first and most important line of defense. Imagine this scenario. You're in the middle of surgery when suddenly you have a severe allergic reaction to a medication. Your blood pressure crashes, your airway starts to swell, and your heart rhythm becomes dangerously irregular. The surgeon is focused on the procedure and may not even notice what's happening to your vital signs. But the anesthesia team notices immediately. They see the changes on their monitors before symptoms even become visible. And they have seconds, not minutes, seconds, to respond appropriately. They might need to administer epinephrine to counteract the allergic reaction, give IV fluids to support your blood pressure, or even perform emergency intubation if your airway is compromised. Or consider another scenario: sudden cardiac arrest during surgery. It's rare, but it happens. The anesthesia team immediately begins CPR, administers cardiac medications, and coordinates with the surgical team to determine whether to continue or stop the procedure. They're essentially running a full-scale medical emergency while the rest of the team focuses on their specific roles. So what does it take to become one of these medical guardians? The training is absolutely extraordinary, and frankly, more extensive than most people realize. First, you need 4 years of undergraduate education, typically with a focus on sciences like chemistry, biology, and physics. Then 4 years of medical school, where you learn the fundamentals of human anatomy, physiology, pharmacology, and pathology. But that's just the beginning. After medical school comes residency, 4 full years of specialized training in anesthesiology. This isn't classroom learning. This is hands-on, high-stakes medical training, where you're gradually given more responsibility under the supervision of experienced physicians. During residency, they rotate through different specialties: cardiac anesthesia for heart surgeries, pediatric anesthesia for children, obstetric anesthesia for childbirth and C-sections, neurosurgical anesthesia for brain and spine operations, trauma anesthesia for emergency surgeries. Each specialty has its own unique challenges and requirements. Next time you or someone you care about needs surgery, remember this. Sure, the surgeon is a superstar. Give them a round of applause for their incredible skill. But don't forget, there's a quiet hero right at the head of the bed, working magic you might never even notice.
ตั้งใจพี่ดิ้งเรชาทีเรื่องที่พายปีลาน้องนิสเปผู้เช่น
They're the ones making sure you feel absolutely nothing, tracking every heartbeat, every breath, every second. They're adjusting medications on the fly, ready to leap into action if anything goes sideways. These are the guardians you never see, the protectors whose names you might never know. But their expertise is the difference between a smooth, safe surgery and disaster. How amazing is that? If this blew your mind or opened your eyes to the incredible world of anesthesiology, smash that like button and subscribe. Join us for more behind-the-scenes adventures into the fascinating, high-stakes world of medicine.